India has been spending quite low on the health. This is something which all of us know right from decades. India spends only 1.28% of its GDP on health. On the contrary, countries like China spend 3% of its GDP, and several other developed nations spend quite a lot on the health of their people. So, unfortunately, we spend more on the security of the nation than the security of the people. This is what the United Nations Development Program, UNDP Human Development Report has observed. So, and out of this very meager expenditure on health, more than 74% is the out-of-pocket expenditure, which means the private individuals spend on their own, but the public expenditure on health is relatively much lower. So this is a whole story. We know it, and National Health Policy of 2017 hope for a increase of health expenditure to 2.5% of GDP, but this did not materialize. We still remained at 1.28%. Way back in 2004, when the Congress party came to power, its manifesto said that India would spend around 2 to 3% of its GDP on health within 5 years, but that really did not materialize. So whether it is BJP in power in 2017 or whether the Congress in power in 2004, the reality is India continues to spend very less on health. So if you rank the countries in the world in terms of their allocation for health as a proportion of GDP, India has a dubious rank of 186 in 200 countries. This shows that we spend very little on our health of our people, despite a very serious comorbidity and mortality prevalent in India. Even today, infant mortality stands in India at 30, whereas it is around 8.5 in the United States of America. So therefore, we need to spend more on the health of the people. Well, this is a general statement. But what everybody thought was that the pandemic will teach the governments a lesson. We only expected that the wisdom will dawn on governments in the wake of the pandemic. But unfortunately, that also did not materialize. So if you look at the Union Budget 2021-22, we have a bizarre claim of the Finance Minister. Finance Minister, while presenting the budget, said that the spending on health and well-being is increased by 137%. So obviously television channels flashed it with headlines, massive push to the health sector, and the next day newspapers gave headlines across the first column to the last column. But what is the reality? Yes, 137% increase is true, but that is not true for the health. So what the finance minister indulged in a fiscal jugglery. What did she do? She has combined health with drinking water and sanitation to create a larger budget size and indicate that it is a 137% increase. So, but in reality, the money spent on the health has actually declined. I am quoting you the figures which are available in the public domain, which are official figures. As per the revised estimate for the last fiscal 2021, the government of India has spent 78,866 crores on health. So 78,866 crores were spent on health as per the revised estimates of the 2020-21. So this was the year when the pandemic has actually swept the country. So obviously everybody thought that the 21-22 budget will witness a more allocation for health. But this did not happen. The allocation for health per se in the Union Budget 2021-22 has declined to 71,269 crores. So in absolute terms, it is a decline of 7,597 crores. So which is absolutely unacceptable. There is almost a 10% decline on the allocation for health. So, well, can anybody justify this lower allocation for the health sector in the age of pandemic? Well, however, government may have its own defense. Government may claim that this is only allocation for the health. There is another separate budget for vaccination. It is true. The Union Budget 2021-22 has allocated 35,000 crores for the vaccination. But believe me, it is only a one-time allocation. So it will not be repeated in the subsequent budget. So therefore, a one-time allocation of 35,000 crores for vaccines cannot be included in the health budget and claim that the health expenditure has increased. And what did really actually happen? So Government of India allocated 35,000 crores for the vaccines, but did it really spend? So the finance minister for state finance, Anurag Thakur, in a tweet has revealed recently that the total expenditure on vaccination till recently, well, I am giving you the data for a couple of weeks back, so this might have actually increased a little bit. The total money spent on vaccines was 4,744.45 crores. So 4,744.45 crores, which means though the budget has allocated 35,000 crores for vaccination, what was actually spent was below 5,000 crores. Can anybody accept this? You have hardly spent 14% of what was allocated. Well, this is not I am questioning. The Supreme Court in the Suo petition, the bench led by D.Y. Chandrachud, Justice D.Y. Chandrachud, has actually questioned the government. Where has that money gone? So how did you spend this 35,000 crore allocation for vaccines? You get me the details. This was the Supreme Court or the Government of India. Kerala High Court actually said recently the Reserve Bank of India has transferred 99,121 crores as dividend to Government of India. Surprisingly, even the budget, this is 53,000 crores, more than what was anticipated in the budget. So when Government of India gets 53,000 crores more than anticipated in the budget in the form of RBI dividend, why can't you spend on vaccines? This is what the Kerala High Court said. So 35,000 crores you have the allocation for vaccines, another 53,000 crores you have it. You had the bonanza from the Reserve Bank of India, which you are not expected. So obviously this 88,000 crores will be more than sufficient to vaccinate every Indian with 2 doses. Yet the center says we will not, and this is the backdrop on which the Supreme Court has clearly asked the Government of India, why can't you buy 100% of vaccines from the vaccine manufacturers? This is the backdrop against which 11 chief ministers are now asking the government to spend for vaccines, central government to spend for vaccines. Well, the United States is a more federal country than India. States in the United States are more power than what we have in India. But today in United States, it is the federal government which procures vaccines and distributes it to the states and even the private hospitals. So everything, the vaccination is free in a free market country like United States. So until now, every vaccination program, every universal immunization program has always been funded by the Government of India. But this time, center chose not to fund the universal vaccination, not to release the 35,000 crores which it itself has allocated in the budget.